Mycoplasma synoviae, MS, causes an acute to chronic infection of chickens and turkeys known as infectious synovitis, leading to exudative tendinitis and synovitis and higher condemnation rates. This infection is most often subclinical and affects the upper respiratory tract, mainly in multi-age layer flocks. It can also appear as a secondary infection with other diseases like Newcastle disease or infectious bronchitis. The infection is prevalent worldwide, notably in chickens and turkeys, but other birds like ducks, geese, guinea fowl, parrots, pheasants, and quail are susceptible. MS, more fastidious than Mycoplasma gallisepticum, is transmitted through eggs, transovarian transmission, but breeder hens have a low infection rate, making some hatches free from infection. Horizontal transmission occurs through the respiratory tract, through both direct and indirect routes. Clinically, slight rales may appear in birds with MS respiratory infection, although signs often go unnoticed. Birds under stress or with concurrent infections are more susceptible. Early signs of infectious synovitis include pale bluish head parts and widespread lameness, causing birds to sit frequently. Severely affected birds show depression and rest around feeders and waterers, with swollen hocks, foot pads, and sternal bursitis, breast blisters. Morbidity is usually low to moderate, with mortality rates ranging from 1% to 10%. Unlike MG infections, MS infections show more pronounced joint lesions, particularly in turkeys. While egg production generally remains unaffected, transient drops can occur in layer flocks, and MS has been linked to eggshell abnormalities. Respiratory lesions, if present, may be mild and include mucoid tracheitis or sinusitis with sacculitis, particularly in stressed birds. Early in the infection, a creamy to viscous yellow-gray exudate is seen in synovial structures, notably swollen hock and wing joints. In chronic cases, this exudate may harden. Additional symptoms include enlarged, sometimes green livers, enlarged spleens, pale kidneys, weakness, thinness, and breast blisters from sternal recumbency. Diagnosis is mainly through PCR or MS bacteria isolation. Serology can assist, but has limitations. Preventing and controlling Mycoplasma synoviae involves sourcing chicks from MS-free breeder flocks, practicing biosecurity, maintaining good management, and using antimycoplasmal drugs as preventive medication.